like to welcome you all to the news at 6. An Idaho doctor and 4 undocumented patients are suing the state of Idaho. They claim a new Idaho law will illegally cut off life-saving HIV medications from immigrants who are legally entitled to them under federal programs. Our Aspen Shumpert joins us here in studio, who spoke with the attorneys about why they're trying to stop this law. Aspen?
Yeah, Jude, House Bill 135 is set to go in effect July 1st, but the lawsuit argues the state oversteps state boundaries into federal immigration law and violates the Constitution.
Our state has a finite amount of resources, and I don't believe that we should be using taxpayer funds to be paying for folks that aren't here lawfully.
House Bill 135, which takes effect July 1st, will require people to prove they are in the country legally before accessing certain public benefits.
The state is attempting unconstitutional actions because it cannot regulate immigration or access to federal benefits and programs in our state as provided for by the federal government. Our elected leaders must respect both the Constitution and federal rules and regulations that protect our most vulnerable people.
Paul Carlos Southwick, legal director at ACLU, says it's a range of benefits being affected by the law.
The basic necessities of life: food, medicine, vaccines, pre- and postnatal care,
including a federal program that provides free HIV drugs to low-income patients. The lawsuit centers on Dr. Abby Davids, who treats HIV patients at Full Circle Health in Boise, and 4 undocumented patients that rely on the HIV medication. Dr. Davids says more than 60 of her patients could lose access to that medication that suppresses the virus and stops it from spreading.
Without medication, it is universally fatal, and it is a slow and painful suffering death that is totally unnecessary when we have very good treatments for this condition.
David says the law is confusing because it doesn't say which immigration statuses qualify.
It makes it really hard to continue to care for our patients.
Attorneys on the case say the law creates fear in undocumented immigrant communities.
Well, this cruel bill does nothing, as Dr. Davids shared, to improve the lives of Idaho residents. Quite the opposite. It threatens the health and well-being of Idahoans across the state.
And that the bill targets what attorneys say are hardworking families who contribute to the GEM state.
The proposed bill would strip these individuals and their families of access to basic health care, denying pregnant women nutritional support and denying others life-saving medication. It sends a disturbing message that despite immigrants' sacrifices and contributions, their families are not valued in Idaho.
Southwick says the court may decide as early as Monday whether to grant a temporary restraining order on the law. Jude, I also reached out to both of the bill's sponsors on this to get their reactions. We did not hear back from them today.
Aspen, I spoke with the Idaho Food Bank a couple of weeks ago, and they said that this bill impacts quite a few of their programs.
Yep, that's another aspect of this bill, the food part that we heard Southwick talk about.
All right, thank you for the report.